Austin Radiological Association provides many women's services, including mammography, bone densitometry, breast ultrasound, breast MRI, and breast biopsy. The following recounts the emotional experience of one of our mammography patients.
Well, the procedure that I had took me to the journey of a diagnosis, which, nobody likes to hear that they have cancer. But on the other hand, had I not come in, had I not had mammography, and had I not had good physicians that were willing to sort of step the line and say, this is something that I think that you need to investigate, I would not have probably had the prognosis that I do now. My journey began at Austin Radiological when I was told that I needed to have a second mammogram done as a follow-up to my first mammogram, which had a suspect area, and my physician referred me to ARA. I came to the Women's Imaging Center here down in Austin and felt that it was a clean facility. I felt comfortable. The waiting room was nice and comfortable. But the best thing, I think, was the staff. The people at the receptionist desk are always, were always very kind and quickly scheduled me for something. They knew I was there for a follow-up. They knew what procedures I should have done. And had the mammograms done and was told to wait, and that the radiologist would speak to me about it after she was able to review them. She thought that I should have a stereotactic biopsy because there was an area that was very, very small, which was great news for me, but that she really felt that needed some further investigation. I felt a little concerned, and I don't know whether she read that or whether she just normally would do this, but she let me know that they consult often as team members on procedures, and that reassured me that there was nothing of concern, that she knew what she was doing, and that they just work as a team to make sure they get the best possible outcome for their patients. I felt great when I left the procedure, and felt reassured that they were working in my best interest to make sure that they got things right. So after that particular procedure, I waited 7 days. Seems like a long time, but I got my results back, and the results were that I had cancer. And we need to understand that the first steps that we take are the important steps, and that taking that first step to get the mammogram done and having confidence in the people that are doing the procedures for you makes all the difference in the world in how you proceed.